Hello, everyone, and welcome to the second session of generic brand name, drug class, and pharmaceutical form and dosage. The second session will be focusing on the autonomic nervous system. I'm Dr. Khalid Hassan, a professor of clinical pharmacology and clinical research. First section, we focus on the cholinergic, and in the cholinergic, we have two main parts. We have cholinergic agonist, then we have cholinergic antagonist. Regarding cholinergic agonist medication, we have here acetylcholine. Okay, then we have bithanicol, carbachol, cevimeline, and bilocarbin. Acetylcholine, with the brand name Mayacol, and this medication considered like direct cholinergic agonist that mean stimulate both muscarinic and nicotinic receptor. Again, I refer you here to the complete lecture on the YouTube regarding the cholinergic agonist. Clinical use for acetylcholine, of course, is very rare to use in the clinical practice, but could be used in the surgical to induce a surgical meiosis and facilitate surgery during the eye surgery. How this medication work? This medication apply to the eye as a intraocular solution, 1%, like 20 milligram per 2 milliliter vial. Very rare to use, but could be used in the clinical practice. Okay, the second medication we have bithanicol uricoline, brand name. How this medication work? This medication mainly affect muscarinic receptor M2 and M3, bithanicol. This medication used for patients suffer from urinary retention, non-obstructive urinary retention, neurogenic bladder, and GERD. So, regarding urinary retention and neurogenic bladder, again, I refer you to the lecture, my YouTube lecture that explain the effect of muscarinic receptor and overactive bladder and or uh, benign prostatic hypertrophy. Bithanicol available as a tablet, 5 milligram, 10 milligram, 25, 50 milligram. Bithanicol also available injectable solution, 5 milligram per milliliter. Carbachol, Miostat, isoptocarbachol, carbachol. The carbachol here stimulate direct stimulation of muscarinic and nicotinic receptor here. So we need to remember that carbachol. We use this medication for glaucoma. We use it for surgical to induce surgical meiosis, and in this case, we injected directly intraocular, and use also in patient with open angle glaucoma. How this medication available? The carbachol available like intraocular solution, 0.01% ophthalmic solution, and we have also another concentration 0.75 and 3% of this carbachol. Cevimeline, we have Evoxac. The cevimeline direct stimulation of muscarinic receptor. Um, this medication used for Sjogren syndromes, which mean a case or associated with the dry mouth, and another name xerostomia, cevimeline. The similar situation here, we bilocarbon, isoptocarbon. Bilocarbon mainly stimulate muscarinic receptor. Here we're talking about M3 receptor. Uh, we're looking on the M3 receptor, direct stimulation of the receptor, direct stimulation of the muscarinic receptor. Bilocarbon, considered like one of the most important medication for glaucoma, which means increased intraocular pressure. Bilocarbon available as ophthalmic eye drops. Bilocarbon also available for the patients suffer from Sjogren disease and dry mouth after radiation, and bilocarbon in this case prescribed orally. So as you can see here for the dosage and the pharmaceutical form, Pilocarpine available as oral tablets, 5 milligram, 7.5 milligram, and this is for oral tablet. Pilocarpine also available as ophthalmic solution, ophthalmic gel by 0.5%, 4%, and ophthalmic gel 4%. Okay, continue with the previous one was direct. The previous slide was a type of medication that direct stimulate the muscarinic receptor. The second part will be a group of medication indirectly activate the acetylcholine receptor. Could be nicotinic, could be muscarinic receptor. So what we have here so far, we have imipinium, um, methylase, brand name, and this medication, how this medication work, as you can see here, this medication inhibit enzyme called acetylcholinesterase. So this medication considered like acetylcholinesterase inhibitor. So the characteristic of amibinium is like reversible inhibitory of the acetylcholine. Amibinium available like um, um, for treatment of myasthenia gravis, which related to the autoimmune disease. Amibinium available like tablet 10 milligram. Here we have to mention important things. They found the imibinium like very short half-life and normally used for diagnosis of myasthenia gravis, not for the treatment. Danabazil, Arcept, Danabazil also irreversibly inhibit acetylcholinesterase. Acetylcholinesterase, this enzyme responsible for metabolism of acetylcholine. So when you inhibit acetylcholinesterase, the result will be an accumulate or increased level of acetylcholine. Danabazil, uh, we use this medication for the treatment of Alzheimer's disease for patients from mild, moderate, or severe. Uh, Here they found in patients with Alzheimer's disease, they have deficiency of acetylcholine and neurons activity. Okay, danabazil available as a tablet, 5 milligram, 10 milligram, 23 milligram, or like 5 and 10 milligram. And another form is this one, like we ask the patient to swallow the tablet. Another form, ODT, and that means this tablet will be dissolved, oral dissolved tablets. This tablet will be dissolved in the oral cavity. No need to swallow this tablet. And here we can get the rapid action of the medication because the medication will be dissolved in the saliva and absorbed through the blood circulation directly and avoiding the absorption in the GI system. Next, we have galantamine. Galantamine in medication for Alzheimer's disease. You can see here for galantamine, consider like acetylcholinesterase inhibitor, and the brand name Residine or Razidine. Okay, inhibit the enzyme acetylcholinesterase, and we have the same similar mechanism. They galantamine presents some nicotinic agonists, mimic the effect of nicotine, and galantamine also used for Alzheimer's disease. Now we have two medication for Alzheimer's disease, danabazil and galantamine. Galantamine available like tablet, 5 and 12 milligram, extended release capsule, 8 24 milligram, and solution 4 milligram per milliliter. Okay, moving to the next medication, we have neostigmine. Neostigmine here, we brand name prostigmine. And prostigmine again, but the same medication. You can see this a group of medication here belong to the same group of medication. Imibinium, danabazil, galantamine, neostigmine, all related to the reversible acetylcholinesterase inhibitor. The same that will be we have another one here. We have visostigmine. Okay, so we'll continue with the neostigmine here. Neostigmine used for treatment of myasthenia gravis. Neostigmine used for reversal of non-depolarizing NMP, stand for neuromuscular muscle blocker. If the patient prepare for the general anesthesia and surgery, we prescribe neuromuscular blockers such as atracorium or cisatracorium. So if you need to reverse this action of this medication, we can use neostigmine. Neostigmine used for urinary retention and ileus. Ileus means paralysis of the intestine. Okay, so neostigmine available as tablet 50 milligram, also available injectable as zero point 0.5 and 1 milligram per milliliter as ampule and vial. Visostigmine, the last medication on the list here, visostigmine, we have antilirium. Visostigmine, we have antilirium. And again, the same mechanism of action, anticholinergic toxicity, and the poisoning reversal. And this medication available as injectable solution and ampule. Okay, continue speaking about indirect acting cholinergic agonist and reversible here. We have pyridostigmine and brand name Mistinone, ACE inhibitor, acetylcholinesterase reversible, and the pyridostigmine used for myasthenia gravis treatment. We use it for the patient poisoning with the nerve gases as prophylaxis treatment. Pyridostigmine available as a tablet 60 milligram, extended tablet 180, available as syrup 60 milligram per 5 milliliter, injectable 5 milligram per milliliter ampule. Rivastigmine, we have brand name Exelon, rivastigmine, brand name Exelon, and again acetylcholinesterase inhibitor reversibly, and they found also inhibit butyrylcholinesterase. So butyrylcholinesterase, this enzyme available in the plasma. Okay, however, acetylcholinesterase enzyme available in the neuron. So we need to differentiate these two enzymes. Rivastigmine, they found it's like reversibly inhibit these two enzymes. Rivastigmine used for Alzheimer's disease, and some study may be indicated using for dementia and Parkinson's disease. We have some patient with a dementia and Parkinson's disease, dementia. So here the purpose to treatment of dementia and patient with Parkinson's disease. Available as capsule, Exelon, rivastigmine solution, transdermal patch. Okay, next medication we have tacrine or tacrine, cognex, tacrine, also available like or considered like acetylcholinesterase inhibitor, reversible. Use it for Alzheimer's disease. Tacrine very rare used now due to the hepatotoxicity. Available as capsule 10, 20, 30, 40 milligram. Next medication we have icothiopate, phospholine iodine, icothiopate. This medication considered like acetylcholinesterase inhibitor, icothiopate, a reversible organophosphate. So we use icothiopate for the patient get poisoning by the insecticide or organophosphate, icothiopate. Icothiopate used for glaucoma, open angle glaucoma, and we use it for accommodated astropia. Icothiopate available as ophthalmic powder with a solution 0.125%. Last medication belong to the cholinergic agonist. We have bralidoxime. Bralidoxime and the brand name Brotobam. Bralidoxime, the brand name Brotobam, and other maybe medication name PAM, Brotomab, bralidoxime. And this one considered like acetylcholinesterase reactivator. And we use it here for patient get poisoning by the organophosphate, by the nerves gas, or by insecticide. Pralidoxim available as in tablet 500 milligram or as injectable powder 1 milligram per vial. Okay, let's move to the next section. We already covered the cholinergic agonist. The next section, we are going to speak about cholinergic antagonist. Here we have two main receptor. We talk about anti-muscarinic receptor, M3, M1. We have M2, and we have M4, and then we have M5. And another group of receptor here, we have nicotinic receptor. So we are going to speak about cholinergic antagonist, anti-muscarinic, and nicotine or nicotinic antagonist. Okay, start with the anti-muscarinic agent. As you can see here, anti-muscarinic agent. We have the prototype, the main medication, atropine. So atropine, we have the atropine, anti-muscarinic drug, and non-selective. That means all receptor from 1 to receptor 5 will be blocked by atropine. Okay, so if you when you prescribe atropine to your patient, we can use it for patients of from bradycardia or atrial ventricular block or organophosphate poisoning, post-operative anti-secretion, and we can use it for ophthalmic dilation. So this one very important because if someone suffer from hypersecretion of saliva, hypersecretion on the GI tract, or it's hypersecretion in the urinary system, atropine cause dryness and decreased secretion. Atropine available as injectable solution, as you can see here, available as vial or ampule. Atropine or could be available as ophthalmic solution with some pharmaceutical form available as ointment. Okay, next we have benztropine. Benztropine, brand name Cognitine. Cognitine, anti-muscarinic medication, mainly work on the central nervous system. We use it for patients of from Parkinson's disease and drug-induced EBS, stand for extrapyramidal syndrome. This syndrome occur as a side effect of antipsychotic drugs. Benztropine available as tablet 0.5 milligram, 2 milligram, and available as injection 1 milligram per milliliter as ampule. Next, we have cyclobentolate. Cyclobentolate, we have acebentolate, cyclogel, antimuscarinic, available cyclobentolate, available like ophthalmic. We use it to treat cycloplegia for refraction, cause mydriasis. We use it cyclobentolate to induce mydriasis for ophthalmic examination. So the mydriasis mean increase the diameter of the pupils and facilitate eye examination. Cyclobentolate available as ophthalmic solution 0.5, 1, and 2%. Okay, darphenacin brand name Enablex anti-muscarinic, and mainly it affect M3 receptor. Darphenacin used for overactive bladder, and we use it also for the patients of from urge urinary incontinence. Darphenacin available as extended release tablet 7.5 and 15 milligram. Next medication we have phosphoridine and brand name Tofiaz, anti-muscarinic medication, overactive bladder and urinary incontinence, available as extended release tablet 5, 4, and 8 milligram. Continue the list of anti-muscarinic. We have ipratropium. Let me go back. We have ipratropium here and brand name Atrovent. This is one of the most important medication. Ipratropium belong to the anti-muscarinic. Ipratropium could be available as bronchial inhaler or nasal inhaler. This medication used for the COPD bronchospasm for treatment of COPD bronchospasm inhalation. We use it for allergic rhinitis as a nasal spray. Available as meter dose inhalation, 17 microgram. We have nebulizer, and we have nasal spray with different maybe dosage there. Okay, atropine, ipratropium. Ipratropium atrovent for the COPD and nasal spray for the allergic rhinitis. Oxybutynin, oxybutynin brand name Ditroban, antimuscarinic and smooth muscles relaxation. Oxybutynin, antimuscarinic, smooth muscle relaxation, mainly affect the bladder. Therefore, we use oxybutynin for overactive bladder. We use it for patients of from urinary incontinence or urogenic bladder. Available as oxybutynin as tablet, 5 milligram, extended tablet, 550 milligram. Available as a solution syrup, 5 milligram per 5 milliliter. Could be available as batches, 3.9 milligram. Topical gel also available, 10%. Moving to the next medication, scopolamine transdermal scope. Transdermal scopes antimuscarinic and scopolamine able to arrive to the central nervous system. For this reason, here scopolamine used for motion sickness. We use scopolamine for patients of from nausea and vomiting after surgery. Scopolamine, some study make it available as ophthalmic cycloplasia and induce mydriasis. Available as a batch, skin batch, 1 milligram every 72 hours, or ophthalmic solution injectable. Sulfafenacin, we have Physicare, antimuscarinic, M3, selective, black M3 receptor there. We use sulfenacin for the overactive bladder and urinary incontinence, and available as tablet 5 and 10 milligram. Tiotropium and the brand name Spirivia, and this medication used for COPD maintenance, asthma maintenance. Tiotropium considered like long-acting inhaler, and we call this one LABA. So if you are interested in learning about COPD and asthma, I recommend you to review my YouTube on the COPD and asthma. The tiotropium available as powder capsules, as inhaler, and the brand name Respimat. Okay, we will continue what we have about the antimuscarinic agent and NMJ stand neuromuscular blockers. Continuing with the antimuscarinic agent, we have toltrodine, we have trihexyphenidyl, tropicamide, trosium chloride, and nicotine. Start with the first medication, toltrodine, and the brand name Ditrol, and Ditrol antimuscarinic, and toltrodine used for overactive bladder and urinary incontinence. Trihexyphenidyl, Artane, brand name, antimuscarinic medication, affect the central nervous system. Trihexyphenidyl, this medication used for patients suffer from Parkinson's disease or patients suffer from extrapyramidal symptoms induced by medication, and we call this one drug-induced EPS. Trihexyphenidyl available as a tablet, 2 5 milligram, and elixir syrup, 2 milligram per 5 milliliter. Tropicamide, midriasil, tropicamide, and brand name midriasil or tropicacil, antimuscarinic ophthalmic solution, short acting. So short acting could be applied to the eye, and the duration of acting will be 4 hours. And tropicamide induce cycloplasia, cause cycloplasia, and tropicamide induce mydriasis, and this will facilitate fundoscopy examination, retina examination. Tropicamide available as eye drops, oral solution, 0.5 and 1%. Trispium chloride, Sanctura, trispium chloride, Sanctura. We have antimuscarinic, no effect on the central nervous system, trospium, and this may be used for overactive bladder. As you can see here, we have toltrodine, trospium for overactive bladder. So we need to be maybe concise with this one here. Nicotine is like nicotine, nicoderm, and we have nicorite. Nicotine considered like ganglionic blocker with a high dose. With a low dose, considered like nicotinic agonist. We use nicotine as batches, as you can see here, to help facilitate stop smoking cessation, and also available as a lozenge. Okay, moving to the neuromuscular blocking agent. If you need more information about this medication, maybe more explanation, clarification, what is this medication, how this medication works, the mechanism of action, some images, I recommend you to review the YouTube lecture regarding neuromuscular blocking agent or cholinergic antagonist. Okay, so what we have here for this group of medication, we have cisatracorium, okay, Nimex, and non-depolarizing blocker, muscarinic blocker. This medication used to induce skeletal muscle relaxation during intubation, during surgery. Could be used during intensive care unit ventilation, facilitate ventilation. Cisatracorium available like injectable solution, vial 2 milligram per milliliter, and we have 10 milligram per milliliter. We have bancuronium, bafilon, bancuronium, non-depolarizing agent, surgical muscle relaxation, controlled ventilation, long acting, available as injectable. Most of these medication, as you can see here, most of these medication for muscle relaxation injectable. So what we have is atracorium, bancuronium, rocuronium, succinylcholine, and fucuronium. The only one here, if you look on the succinylcholine, this considered like depolarizing agent, nicotinic agonist. That means this, the first of all, the succinylcholine bind to the nicotinic receptor, stimulate the nicotinic receptor, and the next step will be desensitization of the nicotinic receptor. It's not maybe able to respond to the medication anymore. This medication considered like short duration of action. Fucuronium, valuable only generic name. We don't have brand name. Non-depolarizing agent. So as you can see here, the only medication in this list, succinylcholine, short acting and depolarizing agents. I believe with this slide here, we conclude the cholinergic agonist and antagonist. We move to the adrenergic agonist and antagonist. Okay, so adrenergic agonist and adrenergic antagonist. The first part, we start talking about adrenergic agonist. Again, when you talk about agonist, here we talk about a group of medication able to bind to the adrenergic receptor, bind to the adrenergic receptor and activate this receptor. So keep in your mind, when you talk about agonist, that means able this medication able to bind to the receptor and activate the receptor. We start with the direct acting adrenergic agonist. We have albuterol, clonidine, dobutamine, dopamine, and epinephrine. Okay, so start with the first medication, albuterol, a brand name Broair, and Ventolin, another name. This is considered like direct B2, direct beta 2 receptor agonist. With the SABA stand for short acting adrenergic agonist, SABA. Albuterol mainly used for asthma. Albuterol could be used for COPD, And for patients from bronchospasm, exercise-induced bronchospasm, sometimes we use it for patients from hyperkalemia, and in this case should be prescribed IV. This medication, albuterol meter dose inhalation, could be available through the nebulizer, or could be injection when you talk about hyperkalemia. Cla- Clonidine, brand name Catabrex, Catabres, Clonidine, selective alpha 2 agonist, work on central nervous system. Clonidine used for treatment of hypertension, ADHD, opioid withdrawal, and menopausal flushing, spasticity, epidural. When you injected epidural used for treatment of spasticity. Clonidine available as a tablet and injectable with a different doses, zero point 0.1, zero point 0.3 milligram, available as patches and injectable epidural for the spasticity. Moving to the dobutamine, Dubutrex brand name. Dobutamine mainly selective beta 1, mainly activate beta 1. Okay, so albuterol mainly activate beta 2. Okay, the butamine mainly activate beta 1. The butamine mainly activate beta 1. Okay, the butamine used for acute heart failure, acute decompensated heart failure. The butamine could be used for patients from cardiogenic shock. The butamine available as injectable and mainly used for in the emergency room and ICU. Dopamine, another name, dopamine, another medication, entroben, considered like dopaminergic, stimulate dopamine receptor, stimulate beta 1 receptor, stimulate alpha 1 receptor. And when they say dose dependent, that means when you increase the dose, you start stimulate these receptor. So at lower dose, dopamine receptor will be activated. Medium dose beta 1, large dose will be activate beta alpha 1. Dopamine used for cardiogenic shock, septic shock, acute heart failure, and renal perfusion, to increase renal perfusion with a low dose. Next medication we have epinephrine. Epinephrine we have Epiben as brand name, adrenaline also. Epinephrine considered non-selective. Stimulate alpha 1, stimulate alpha 2, stimulate beta 1, stimulate beta 2, and stimulate beta 3. So non-selective medication, epinephrine. Epinephrine could be used to treatment of anaphylaxis, cardiac arrest, severe asthma, and severe bradycardia. Epinephrine available as auto-injector, injectable medication also available, available as meter dose inhalation, epinephrine available as ophthalmic solution. Okay, moving to the maybe continue with the speaking about direct acting adrenergic agonist, phenoldoban. Corloban, brand name, selective D1 receptor. So phenoldoban D1 receptor selective agonist mean activate the receptor. And this medication used for the emergency of emergency treatment of hypertension. So IV, phenoldoban, emergency treatment of hypertension. Phenoldoban available as infusion, injectable concentration 10 milligram per milliliter vial. For Formoterol, Foradel, and beta 2 agonist, LABA, that stand for long acting, LABA L for long, APA stand long acting beta agonist, LABA. We use this medication for asthma maintenance therapy, for COPD with ICS, stand for inhaled corticosteroids. Okay. Formoterol available as inhalation powder, capsules, and nebulizer. Isoprel is like very rare to use in the practice. Uh, Non-selective beta blocker, b- non-selective beta agonist stimulate beta 1 and beta 2. We use for when someone suffers from complete heart block, bradycardia refractory to the other medication, or torsade deep one, isoproterenol, available as injectable. When you talk about injectable here, we talk about ER, emergency treatment. Norepinephrine, Levophed, stimulate alpha 1 beta 1, norepinephrine, alpha 1 beta 1. We use it for septic shock, and we use it to induce when you have patients are from vasodilatory shock. Okay, and first line will vasopressor for us, hypotension in ICU, intensive care unit, and available as injectable solution. As you can see here, most of these medication for emergency use. Okay, septic shock, vasodilatory shock, phenylephrine, and sodafid, the brand name, selective alpha 1 agonist. We use it as nasal congestion. Patients are from available as injectable for the patients are from hypotension. Could be applied to the eye for mydriasis or for patients with hypotension. So we have three clinical use for phenylephrine. Number one, nasal congestion. Number two, patients are from hypotension. And number three, to induce mydriasis. So three clinical use of phenylephrine. Direct acting adrenergic agonist. Okay, continues talking about adrenergic agonist, direct and indirect. We have salmeterol long acting, LABA, long acting beta 2, servant, discuss. Okay, servant, discuss here, beta 2 agonist for asthma maintenance therapy and available as inhalation. Terbutaline, beta 2 agonist, also for the bronchospasm, COVD, available as tablet and ampule. Amphetamine, Adderall for ADHD and narcolepsy, and indirect stimulate sympathomimetic, norepinephrine and dopamine releaser. Norepinephrine, increase release of norepinephrine and dopamine in our body. And amphetamine may cause the risk of abuse and addiction. Ephedrine, we have various names for ephedrine. Ephedrine work on two mechanisms, direct acting and indirect acting, as you can see here. Mixed acting. Ephedrine used to treat hypotension. We use the ephedrine to local as tablet for nasal congestion or like bronchospasm to treat bronchospasm. So the ephedrine, sodafid, indirect sympathomimetic, mainly work on the norepinephrine release. So the difference between amphetamine affect epinephrine and dopamine. However, pseudoephedrine mainly affect the norepinephrine. Available, we use it for the nasal and sinus congestion, and we use it for the eustachian tube congestion. Available as tablet and liquid. Pseudoephedrine. Okay, we conclude the adrenergic agonist. We move to the last part of autonomic nervous system, adrenergic antagonist. Okay, so we talk about alpha. Here we talk about alpha adrenergic blocker. Alpha blocker here. So alpha blockers, we have list of medication: alphazocine, doxazocine, phenoxybenzamine, phentolamine, and brazosine. Uroxetral, alphazocine, uroxetral, brand name, selective alpha 1 blocker, and alphazocine used for patients from BPH, benign prostatic hypertrophy or hyperplasia. This medication lower urinary tract symptoms, available as extended release tablet 10 milligram. Doxazocine, brand name Cardora, selective alpha 1, very similar to the previous one. Doxazocine, selective. Doxazocine could be used for hypertension and prostate hyperplasia. Available as tablet 1 milligram, 8 milligram, extended release tablet 8 and 4. Phenoxybenzamine black alpha 1 and alpha 2. Okay, phenoxybenzamine black alpha 1, alpha 2, dabenzyline, ventolamine, rigidine, also black alpha 1 and alpha 2. So we have two medication here. How we can differentiate phenoxybenzamine irreversible alpha 1, alpha 2. However, ventolamine competitive and reversible. Both of them we use it for pheochromocytoma, is a tumor produced from tumor in the adrenal medulla. Phenoxybenzamine available as a capsule, phentolamine available as injectable powder. Brazosin, brand name Minibres, alpha 1 blocker. For this reason, we use it for hypertension, benign prostatic hyperplasia, PTSD, and we have nightmares off label here. That means not approved by the by the WHO or FDA. Brazosin Minibres available as capsule 1 milligram, 2 milligram, 5 milligram. Okay, continue speaking about some medication that has effect on alpha and beta blockers. We have tamsuosin, mainly alpha 1, some effect on 1 alpha 1A, mainly alpha 1A, some effect on 1D, tamsuosin, and brand name Flomax. Tirazosin heterin, selective alpha 1, Yohimbine Yukon, selective alpha 2, albuterol Cictral, albuterol, acebutolol, selective beta 1 with the intrinsic effect. Then we have atenolol, brand name Tenormin. I will move to the first one now, temsosin, brand name Flomax, alpha 1A, selective blocker. You talk about blocker. Okay, we use it for benign prostatic hyperplasia, urethral stone, kidney stone that help to maybe remove the stone from the kidneys. Tamsuosin Flomax available like capsule. 0.4 milligram. Tirazosin heterin, selective alpha 1, we use it for hypertension, we use it for benign prostatic hypertrophy, hyperplasia, available capsule 1, 2, 5, 10 milligram. And the reason for this several maybe doses, we can start with a 1 milligram. If the patient's response to the medication, we remain treat the patient with this dose. If the symptoms aggravate, if the disease aggravate, we escalate the dose until 10 milligram. You have been not in the clinical practice, it's not popular in the clinical practice. Um, Acebutolol, Cictral beta 1 acebutolol activator, used for hypertension and ventricular arrhythmias, available as capsule 200 and 400 milligram. Atenolol, brand name Tenormin, atenolol, brand name Tenormin, beta 1 selective, atenolol medication for hypertension, medication used for treatment of angina, acute myocardial infarction, treatment of acute myocardial infarction for patients from supraventricular arrhythmias. Tenormin available as tablet 5, 25 milligram, 50 milligram, 100 milligram, and also injectable 0.5 milligram per milliliter ampule. Okay, continue with the beta blocker here. As you can see, beta blocker. We have bisoprolol, Zepta, brand name Zepta, and this medication bisoprolol, mainly block beta 1 receptor, used for hypertension and for heart failure. Bisoprolol. Carvedilol, Corec or Corec CR, Carvedilol, non-selective beta in addition to the alpha 1. Carvedilol used for heart failure, hypertension, and post post myocardial infarction. Okay, carvedilol available as a tablet, extended release capsule. Ismilol, Brevibloc, Ismilol, Brevibloc, ultra short duration of action, IV only, Ismilol, ultra short duration of action, selective beta 1, IV only injectable, as you can see here, for patients suffering from supraventricular tachycardia, atrial fibrillation, atrial flutter, or postoperative hypertension. So emergency use, ER, or the ICU. Labatalol, very similar to the carvedilol. Labatalol, carvedilol, if you look what we have here, okay, non-selective, beta and alpha. So block beta 1, block beta 2, and block alpha 1. This is labatalol, carvedilol. Used for hypertension, pregnancy, hypertension in pregnancy, and we use it for emergency hypertension. Labatalol available as tablet, labatalol available as injectable. Next medication we have metoprolol. Metoprolol, brand name Librosor, and another medication Tobrol XL. Metoprolol beta 1 selective. We use it for hypertension, angina, myocardial infarction, heart failure. The type of heart failure we use succinate XR of metoprolol. Metoprolol available as tablet and injectable. Okay, last slide. According to the autonomic nervous system, generic brand name, clinical use, group of medication, nadolol. So nadolol, core card brand name, nadolol, non-selective beta blocker, that mean blocking beta 1 and beta 2. Nadolol, we use it for hypertension, we use it for treatment of angina, we use it for varicose bleeding, like portal hypertension. Nadolol available as tablet 20, 40, and 80 milligram. Nebivolol, brand name Pistolic, Nebivolol, Nebivolol beta 1 selective blocker, and Nebivolol help to release nitric oxide. Okay, beta blocker and release nitric oxide. Nebivolol used for treatment of hypertension. Nebivolol available 2.5 milligram tablet, 5 milligram tablet, 20 and 10 milligram. Okay, propranolol, non-selective beta blocker, that means blocking beta 1 and beta 2. The brand name Endiral. This medication used for hypertension, angina, cardiac arrhythmias. Um, we have myocardial infarction, portal hypertension, migraine prevention, essential tremor, anxiety, thyrotoxicosis. A lot of indication for propranolol, but at the same time we have side effect. We need to remember AD, we have ADRs. That mean adverse drug reaction. Take it on consideration. Albuterol available tablet with a 10 to 80 milligram. We have 10, 20, 10, 20, 40, 80 milligram. We have capsule. Then we have injectable, Endiral or propranolol. Timolol, the brand name Timoptic here, and Bitmol, Timolol, non-selective beta blocker, but Timolol used for glaucoma. That means we're talking about eye drops here. Okay, eye drops, ophthalmic solution. Timolol could be available as tablet or like gel. Glaucoma, hypertension, and migraine prevention. And last medication on the list, Reserbine. Reserbine, Serbacil, brand name Reserbine, brand name Serbacil, Anti-adrenergic agents, reserpine. If you prescribe reserpine, the result will be depletion of mediator. Reserpine will lead to the depletion of norepinephrine, dopamine, and serotonin storage. So reserpine depletion agent. Please remember that. By reserpine anti-adrenergic agent. Used for hypertension, very rare to use in the practice. Could be used for as antipsychotic. This only in the medical literature as a history medication. Reserpine available as tablet zero point 0.5 and zero point 0.2 25 milligram. Okay, this will conclude our session regarding generic name, regarding drug generic name, brand name, group of medication, and pharmaceutical form and dosage. I hope you enjoy this session about autonomic nervous system, and we can see you again maybe after to speak about cardiovascular clinical pharmacology, and then we have central nervous system clinical pharmacology and endocrine pharmacology, and we have miscellaneous topic about clinical pharmacology. Thanks so much and have a great day.